Get heart smart with University of Maryland, Baltimore, Washington Medical Center. So not all heart attacks patients end up in the cath lab and bypass surgery. There are a fair number that do get treated with just medications alone. There are a lot of different kinds of heart attacks. And if you're having an acute ST elevation heart attack, no, you're going to come into the hospital, you're going to go to the cardiac catheterization lab, we're going to open up the blockage. In rare instances, those patients may end up needing bypass to fix all of the blockages that are there. And then usually about 3 to 5 days in the hospital with a stent. For surgery, it's a little longer, maybe about 5 days in the hospital, a longer recuperation time. But there are other types of heart attacks. If you look at the diagnosis of heart attacks, there are actually 5 different kinds of heart attacks. The majority of the ones are because of rupture of a plaque or cholesterol buildup in the blood vessels. But there are heart attacks that can happen in the setting of somebody who is profoundly anemic, where their blood counts are very low, and you cause a lot of demand on the heart, where you leak enzymes. So heart attacks are diagnosed by looking at EKGs, but then you can have other types of heart attacks where we diagnose with blood work, where we look at what the enzymes, there are certain enzymes we look at like troponin, and they can be elevated in other cases where you don't have critical blockages, but you have other conditions where you have a lot of stress on the heart. The pressure is low for somebody who is in septic shock or infection. If the blood counts are really low, dialysis patients or patients who have kidney disease sometimes have minor elevations. So there are different kinds of heart attacks. We treat patients medically with medications all the time, but there are times that's all we would treat with just medications. It all depends upon what the underlying conditions are, what other comorbidities the patients have.